afternoon. My name's Dr. Charles Chambers. I'm an interventional cardiologist at Penn State Hershey and Vice President of the Society of Cardiac Angiography and Intervention. It's my pleasure to be here today to talk to Dr. Davidson regarding her abstract on precocious ACS. Dr. Davidson.
Thank you for having me.
My pleasure. Tell us a little bit about your study.
So we were studying patients who presented with acute coronary syndrome under the age of 35. So that enveloped everyone who was coming in with STEMI, NSTEMI, or unstable angina. We looked at two institutions, both Northwestern University and Vanderbilt University, and over the course of 11 years compiled all the patients that came in with those presentations. We found 124 patients overall, and of those patients we looked at both their baseline risk factors as well as their angiographic findings. So in terms of their baseline risk factors, we noticed that there was a very high rate of traditional acute coronary syndrome risk factors, such as hyperlipidemia, smoking, hypertension, and as well as obesity. The things that we found that were sort of out of proportion, even compared to an older, more traditional cohort, was hyperlipidemia and smoking. And an obesity was very high as well. The average BMI in our study was 32.
Wow.
So definitely things that can be modified. The other thing was the angiographic findings that we found very interesting. So found a very high rate of thrombus in the population. But most interestingly, of the people that did present with thrombus, a lot of those people, other than the thrombotic occlusion, had completely normal coronary arteries. So if a thrombectomy were performed, there's just no underlying CAD.
Wow, very interesting.
Yeah.
Was that surprising to you to see that in this population that thrombus played the major role?
Well, we thought that there might be something distinctly different about this population, because why are young people who are traditionally, you don't even think of as being at risk for a heart attack, coming in with this presentation? So in a way, it kind of makes sense that maybe these people would have a hypercoagulable state underlying their disease pathology. So it's an interesting finding, but it almost makes sense when you look back on it.
Absolutely. And obviously cocaine always comes up in the discussion when you have this young population and things like that. Was drug use at all an issue in this population?
We did find that there were some cocaine users, but not a large amount. In fact, all of the cocaine users that we found were men in the study, so none of the women at all.
Very interesting, very interesting. With this type of findings, you know, I mean, if you ask a primary care doc and someone has high cholesterol in their 20s and 30s, if they're a little obese, you know, if they smoke, they don't think about doing things like aspirin or aggressively treating cholesterol. Do you think that's something that should be looked at more aggressively? Absolutely.
I mean, I don't think that we necessarily have the data at this point to strongly recommend that, but I think that it's something that should be looked at and strongly considered. Aggressive lipid-lowering therapy, initiating statins in younger people, there's not a ton of side effects associated with that if they tolerate the statin, and that could really change kind of the landscape of where their health would be headed. Smoking interventions is obviously something we're already doing, but maybe if we have something to say to people that you could really have a heart attack at this age if you don't stop smoking, would give them a little more incentive to stop.
Absolutely, absolutely. Well, it's an excellent study. Is there anything that we didn't cover during the conversation you'd like to emphasize to the audience? Or?
I just think that both patients and physicians need to be aware that this is out there, and that acute coronary syndrome is not just a disease of an elderly population, but it's also a disease of the young population, and potentially interventions can be made at a younger age to prevent these devastating events from happening.
Well, excellent discussion and an excellent presentation. I think this is things that people need to be aware of, and thank you for your time.
Thank you very much.
My pleasure.